Hello again, this is Laura Dockapil. This video is going to talk about bullying and how to handle that in primary care, because that's a topic that I've seen often come up during visits. Again, visits that are not necessarily for psych, but they just kind of uncover bullying that's happening. And I will say that interventions within the school are getting better for bullying, but we also have new challenges with cyberbullying and such. So the intervention I want to show you, I found very effective with my counseling patients, and it's pretty easy to implement. I would say that you could use this on people as young as 6 years old, but what it really does is kind of helps them to identify what is really perhaps the cause of why this person is being or acting like a bully. So we start with pictures, and I want to preface with that these are pictures that I found somewhere online years ago. They're not my cats, so thank you to whoever's cats they were. You can find your own. But when I implement this exercise to a client that's coming in with bullying concerns, what I do is I like to show them this picture first, this series of pictures. And I ask them, I say, you know, what's going on in this picture? What's going on with that cat? You know, can you tell me, what is that cat doing? And of course, you're going to get even your teenagers, because you can do this with teenagers. You're going to say, oh, I don't know. Okay, well, you know, help them through it a little bit. What is the cat doing with its back? What is the cat doing with its tail? I show them this picture as well, and you're free to find your own pictures. Gosh, you can do a different animal if you want, as long as that animal is essentially kind of in a fearful pose. So what I first ask them is, hey, what's going on in this picture? What's that cat doing? You know, and oh, well, it's arching its back, you know, it's showing its teeth. Okay, so as you kind of lead them through this, well, you know, why do you think it's doing that? Why does it arch its back and its fur all poofed up? I mean, what's that about? And eventually they'll kind of come to the answer of, oh, well, you know, it's trying to look big. It's trying to appear like this, you know, because it doesn't like what's going on. It's trying to appear big and scary and aggressive. And once they get to that point, then ask them this: what do you think the emotion of that cat is? Or the feeling that that cat is having? Why is it trying to look so big? And whammo, you're going to get the answer: they're scared. They're scared, so they're trying to look big. And all of a sudden, hopefully you'll see the light turn on in that patient's eye, because they'll go, oh. And then you can kind of make that connection like, listen, you know, bullies act the same way. Bullies feel about this big because when somebody's very confident, they don't have to walk around, you know, all big and scary and everything. They don't have to, because they feel confident. But when somebody feels very small, very non-confident, very afraid on the inside, they have to show out and push somebody else around because they don't want to be the weak one. They're showing out. So that's just a really effective intervention to kind of help that child or adult or whoever it is to kind of understand, okay, why is this picking on me behavior going on? Now, there are a lot of other things that can kind of play into that I'm not going to go into, because that's really beyond the primary care setting. But if you do get a complaint of bullying, or you kind of hear that, that is something that is really effective that I would definitely use. And then go ahead and pursue, you know, interventions with the parents in the school and all the other outlets that you normally would. But like I said, this intervention is a really good one. It's really fast. And you can use those pictures or find your own.